What if the reason you feel winded walking to your car, fatigued by mid-afternoon, or worried every time your doctor mentions your blood pressure is not your age, but the fact that you avoid stairs every single day? Most people think of stairs as something to escape. They wait for the elevator. They park on the ground floor. They choose the ramp. But after 50, those flights of stairs you avoid may be one of the most powerful tools your heart is missing. And here is the surprising part. You do not need a gym membership, expensive equipment, or a personal trainer. The staircase in your home, your office, or your apartment building may be enough to strengthen your heart, lower your blood pressure, and add years to your life. So today we will break down exactly what happens to your heart when you climb stairs daily, how many stairs you actually need, which heart conditions benefit the most, and how to start safely if you have been inactive for years. Before we begin, remember this video is for education only. If you have chest pain, severe shortness of breath, dizziness during activity, a history of heart attack, or symptoms that keep getting worse, please speak with your doctor before starting any new exercise routine. Now let us begin. Most people ask, is stair climbing safe for my heart? But the better question is, what is my heart missing when I avoid stairs? Because the heart is a muscle, and like every other muscle in your body, it responds to the demands you place on it. If you never challenge your heart, it does not stay the same. It gradually weakens. The walls may stiffen. The chambers may become less efficient. The blood vessels that feed the heart may narrow over time. This does not happen overnight. It happens quietly, over years, often without obvious symptoms until something serious occurs. But when you climb stairs, even a few flights a day, you ask your heart to work harder for a short period. And that short burst of effort triggers a chain of changes inside your cardiovascular system that sitting, standing, and even slow walking on flat ground may not fully replicate. So instead of thinking of stairs as a burden, think of them as a daily dose of medicine for your heart. The right dose depends on your current fitness, your medical history, and your goals. Now let us start with what happens to the heart muscle itself. Your heart is roughly the size of your fist. It beats about 100,000 times a day, and every single beat pushes blood through a network of vessels that stretches for thousands of miles inside your body. When you sit or lie down, your heart does not have to work very hard. Gravity is not fighting it. Your muscles are not demanding extra oxygen. The workload is low. But the moment you start climbing stairs, everything changes. Your leg muscles, which are the largest muscles in your body, suddenly need more oxygen. Your heart responds by beating faster and squeezing harder. This is not a bad thing. This is exactly what the heart is designed to do. Think of your heart like a pump in a water system. If the pump only ever runs at low speed, the pipes may get sluggish. Sediment may build up. The pump itself may weaken over time. But when the pump runs at higher speed periodically, it keeps the system flowing, keeps the pipes clear, and keeps the motor strong. When you climb stairs daily, the left ventricle, which is the main pumping chamber of your heart, may gradually become stronger and more efficient. It learns to push more blood with each beat. This means that over time, your resting heart rate may actually go down because your heart does not need to beat as often to deliver the same amount of blood. A lower resting heart rate is generally a sign of better cardiovascular fitness. And research suggests that people with lower resting heart rates tend to have a lower risk of heart disease over time. But this adaptation takes consistency. Climbing one flight of stairs once a month will not change much. Climbing a few flights most days of the week is where the real benefit begins. Now, let us talk about blood pressure because this is one of the areas where stair climbing may make the biggest difference. High blood pressure is one of the most common and most dangerous heart risk factors after 50. It is often called the silent killer because it can damage your arteries, your kidneys, and your heart for years without obvious symptoms. When you climb stairs, your blood pressure rises temporarily. This is normal and expected. Your body needs higher pressure to push blood upward against gravity to your working muscles. But here is the important part. After you finish climbing and your body recovers, your blood pressure may actually drop lower than it was before you started. This is called post-exercise hypotension, and it can last for several hours after activity. Over weeks and months of regular stair climbing, your resting blood pressure may gradually decrease. The walls of your blood vessels may become more flexible. The inner lining of your arteries, called the endothelium, may produce more nitric oxide, which helps blood vessels relax and widen. This does not mean stair climbing replaces blood pressure medication. It does not mean you should stop taking your prescribed pills. But it may work alongside your medication to help your numbers improve. If you already take blood pressure medication, monitor how you feel during and after stair climbing. If you feel dizzy, lightheaded, or unusually fatigued, slow down and speak with your doctor. The goal is steady improvement, not sudden strain. Now, let us move to cholesterol and arterial health. Many people over 50 struggle with high LDL cholesterol, which is the type that can build up inside artery walls and form plaques. These plaques narrow the arteries and increase the risk of heart attack and stroke. Stair climbing may help improve your cholesterol profile in several ways. First, regular physical activity can raise HDL cholesterol, which is the protective type that helps remove LDL from your bloodstream. Second, stair climbing burns calories and may help reduce triglycerides, which are another type of fat in your blood that can contribute to heart disease when levels are too high. Third, the repeated demand on your cardiovascular system may help keep your arteries more elastic and less prone to stiffening. Arterial stiffness is a major concern after 50. As we age, the walls of our arteries naturally lose some of their flexibility. This forces the heart to work harder and raises blood pressure. Regular stair climbing may slow this process by keeping the blood flowing forcefully through the arteries on a daily basis. Think of your arteries like garden hoses. A hose that sits unused may become brittle and crack. A hose that is used regularly stays more supple. Your arteries respond to flow in a similar way. More flow, more flexibility, less plaque buildup over time. But again, stair climbing is one piece of the puzzle. Diet, medication, stress management, and sleep all play a role in your cholesterol and arterial health. Now, let us talk about heart rate and cardiovascular fitness. One of the clearest signs that your heart is getting stronger is how quickly it recovers after effort. When you climb a flight of stairs and your heart rate jumps up, that is normal. But what matters is how fast it comes back down. If you reach the top of the stairs and your heart is pounding for 10 minutes, that may be a sign of low cardiovascular fitness. If your heart rate settles within 1 or 2 minutes, that is a better sign. Over weeks of daily stair climbing, you may notice that your heart rate does not spike as high for the same number of stairs. You may also notice that you recover faster. This is your heart becoming more efficient. It is learning to deliver more oxygen with less effort. This improvement is sometimes called increased VO2 max, which is a measure of how well your body uses oxygen during exercise. Higher VO2 max is strongly linked to longer life expectancy and lower risk of heart disease. And you do not need a treadmill test to notice the change. You will feel it in your daily life. Carrying groceries up the stairs may feel easier. Walking uphill may feel less exhausting. Playing with your grandchildren may leave you less breathless. These everyday improvements are your heart telling you it is getting stronger. Now, let us talk about weight and how it affects your heart. Carrying extra weight, especially around the abdomen, forces your heart to work harder every single minute of every single day. The heart must pump blood through more tissue. It must push against higher resistance. Over time, this extra workload can thicken the heart muscle in unhealthy ways and increase the risk of heart failure. Stair climbing is one of the most calorie-intensive everyday activities you can do. Climbing stairs burns roughly 2 to 3 times more calories per minute than walking on flat ground at a moderate pace. This is because you are lifting your entire body weight upward against gravity with every step. Over weeks and months, this extra calorie burn may help reduce body fat, especially when combined with a balanced diet. And even a modest weight loss of 5 to 10% of your body weight can significantly reduce the strain on your heart. Your blood pressure may drop. Your cholesterol may improve. Your blood sugar may stabilize. Your joints may feel less stressed. So stair climbing supports your heart not only by strengthening the muscle directly but also by helping you carry less weight on your frame. The heart does not care how you lose the weight. It only cares that the burden is lighter. And stairs offer one of the simplest ways to tip the balance. Now, let us talk about blood sugar and metabolic heart risk. Many people over 50 have prediabetes or type 2 diabetes, and both conditions significantly increase the risk of heart disease. High blood sugar damages the inner lining of blood vessels over time, promotes inflammation, it accelerates plaque buildup, and it can damage the tiny blood vessels that feed the heart muscle itself. Stair climbing may help improve blood sugar control in several ways. When you climb stairs, your leg muscles contract powerfully. Those contractions pull glucose out of your bloodstream and into the muscle cells for energy, even without the need for extra insulin. This means that a few flights of stairs after a meal may help blunt the blood sugar spike that normally follows eating. Over time, regular stair climbing may improve insulin sensitivity, which means your body needs less insulin to manage the same amount of sugar. This reduces the strain on your pancreas and lowers the metabolic stress on your heart. If you have diabetes or prediabetes, stair climbing can be a powerful addition to your management plan. But be cautious if you take insulin or medications that lower blood sugar. Climbing stairs on an empty stomach or when your blood sugar is already low may cause dizziness or fainting. Check your numbers, carry a small snack if needed, and talk to your doctor about the best timing. Now, let us talk about inflammation. Chronic low-grade inflammation is one of the hidden drivers of heart disease after 50. It contributes to plaque formation, arterial stiffness, and the gradual weakening of the heart muscle. Unlike the inflammation you feel when you sprain an ankle, this type of inflammation is silent. You cannot feel it, but it is happening inside your blood vessels every day. Regular physical activity, including stair climbing, has been shown to reduce markers of chronic inflammation in the blood. One theory is that muscle contractions during exercise release anti-inflammatory chemicals called myokines. These myokines circulate through the bloodstream and may help calm the inflammatory response in the arterial walls. In simple terms, every time you climb stairs, your muscles may be sending chemical signals that tell your arteries to relax, repair, and resist damage. This effect is not dramatic after one session, but over months of consistent activity, the cumulative benefit may be significant. Your heart is not just a pump. It is part of a living, responsive system that adapts to the signals you send it every day. Now, let us get very practical. How many stairs do you actually need to climb to benefit your heart? This is one of the most common questions, and the answer depends on where you are starting from. If you have been mostly sedentary for years, even one flight of stairs a day is a meaningful starting point. One flight is roughly 10 to 15 steps. That may not sound like much, but for a heart that has not been challenged in a long time, it is enough to trigger beneficial adaptations. If you are already somewhat active, 2 to 5 flights a day may provide more noticeable benefits. Some research suggests that climbing 5 or more flights of stairs per day is associated with a significantly lower risk of cardiovascular disease compared with taking the elevator. But the exact number is less important than the consistency. Climbing 2 flights every single day is better than climbing 10 flights once a week and then doing nothing for the rest of the week. Your heart responds to regular, repeated signals, not occasional heroic efforts. So start where you are. If one flight leaves you breathless, start with half a flight. If 5 flights feel easy, try adding a 6th. The goal is gradual progression, not competition. Listen to your body. If your chest feels tight, if you feel dizzy, or if your heart rate does not come down within a few minutes, stop and rest. Pushing through chest pain is never the right strategy. Now, let us choose stair climbing recommendations based on common heart and health conditions. First, high blood pressure. If your blood pressure is consistently above 130/80, stair climbing may help lower it over time. Start slowly, 1 to 2 flights at a comfortable pace. Do not rush. Do not hold your breath while climbing, because breath holding can spike blood pressure temporarily. Breathe steadily and rhythmically with each step. Monitor your blood pressure at home if possible and track changes over weeks. Second, high cholesterol. If your LDL is elevated or your HDL is low, regular stair climbing may help shift the balance in your favor. Aim for at least 3 to 5 flights most days of the week. Combine this with a heart-healthy diet rich in vegetables, whole grains, and healthy fats for the best results. Third, prediabetes or type 2 diabetes. If your blood sugar tends to spike after meals, try climbing 1 or 2 flights of stairs about 15 to 30 minutes after eating. This may help your muscles absorb excess glucose and reduce the post-meal spike. But if you are on insulin or sulfonylureas, check your blood sugar before climbing to avoid hypoglycemia. Fourth, recovering from a heart attack. If you have recently had a heart attack, stair climbing may be part of your cardiac rehabilitation program, but only under medical supervision. Do not start climbing stairs on your own without clearance from your cardiologist. Your doctor may recommend a specific number of steps, a target heart rate, and a gradual progression plan. Follow that plan closely. Fifth, heart failure. If you have been diagnosed with heart failure, your heart may already be working at its limit. Stair climbing may be too demanding in the early stages. Your doctor may recommend flat walking first and then a very gradual introduction to stairs as your heart strengthens. Never push through severe breathlessness, chest pressure, or sudden weight gain from fluid retention. Sixth, atrial fibrillation or irregular heartbeat. If you have atrial fibrillation, stair climbing may be safe and beneficial, but pay attention to how your heart feels during the climb. If you notice your heart racing uncontrollably, fluttering, or skipping beats more than usual, stop and sit down. Some people with atrial fibrillation tolerate stairs well. Others may need to keep their heart rate below a specific threshold. Your cardiologist can guide you. 7th, obesity and heart strain. If you carry significant extra weight, stair climbing may feel very difficult at first, and it may put stress on your knees and hips. Start with just a few steps. Use the handrail. Take breaks as needed. The cardiovascular benefit begins even with very short efforts. As your weight decreases and your fitness improves, you can gradually increase the number of flights. 8th, sedentary lifestyle with no known heart disease. If you are generally healthy but spend most of your day sitting, stair climbing is one of the fastest ways to reverse the damage of inactivity. Start with 2 flights a day and add 1 flight per week. Within a month, you may notice that your breathing is easier, your energy is higher, and your legs feel stronger. 9th, aging heart with no specific diagnosis. If you are over 60 and simply feel that your heart is not as strong as it used to be, stair climbing may be one of the best anti-aging tools available. It challenges the heart, the lungs, the muscles, and the balance system all at once. But respect your limits. Slow and steady is always better than fast and risky. Now, before we go further, let us debunk a few stair climbing myths. Many people believe that stairs are dangerous for anyone with a weak heart. This is not entirely true. For most people with stable heart conditions, gradual stair climbing under medical guidance is safe and beneficial. The danger comes from sudden, intense effort without preparation, not from stairs themselves. Another common myth is that you need a gym or expensive equipment to strengthen your heart. The truth is that your body weight and a set of stairs provide more cardiovascular resistance than many gym machines. Walking on a flat treadmill at a slow pace may not challenge your heart the way climbing stairs does. Some people also believe that after 60 or 70, it is too late to improve heart health through exercise. This is false. Research consistently shows that older adults who begin regular physical activity, even in their 70s and 80s, can improve their cardiovascular fitness, lower their blood pressure, and reduce their risk of heart events. The heart remains adaptable at every age. It may respond more slowly than a younger heart, but it still responds. And finally, some people believe that if they walk every day, they do not need stairs. Walking is wonderful and should absolutely continue, but walking on flat ground does not replicate the vertical demand that stairs place on the heart. Stairs add a gravitational challenge that flat walking simply cannot match. Both are valuable, but they are not interchangeable. Now, let us build a simple stair climbing plan you can try this week. If you are a complete beginner, start with 1 flight of stairs once a day. Climb at a slow, steady pace. Hold the handrail if you need it. Breathe in through your nose and out through your mouth. Do not hold your breath. When you reach the top, pause and let your heart rate settle before continuing your day. If you feel fine, try adding a second flight after 3 to 5 days. If you are already somewhat active, start with 2 to 3 flights twice a day. 1 session in the morning and 1 in the afternoon or evening. This spreads the cardiovascular stimulus across the day and may be easier on your joints than doing all your stairs at once. If you are more advanced, try 5 to 8 flights a day, broken into multiple sessions. You can also increase the challenge by climbing at a slightly faster pace or by taking 2 steps at a time, but only if your knees and hips allow it. For everyone, regardless of fitness level, follow these safety rules. First, warm up your legs with a few minutes of gentle walking before tackling a long staircase. Second, wear supportive shoes with good grip. Third, use the handrail, especially if you feel unsteady. Fourth, stop immediately if you feel chest pain, severe shortness of breath, dizziness, or palpitations. Fifth, cool down by walking slowly on flat ground for a minute or 2 after your last flight. The goal is not to exhaust yourself. The goal is to challenge your heart just enough to trigger adaptation without crossing into danger. Progress is measured in weeks and months, not in single sessions. Now, what about people who cannot climb stairs due to knee pain, hip replacements, or mobility limitations? This is a very real concern, and it is important to address. If your joints prevent you from climbing stairs safely, do not force it. The heart benefits of stair climbing can be approximated through other activities that raise your heart rate, such as brisk walking on an incline, cycling, swimming, or using a seated stepper machine. The key principle is the same. Your heart needs periodic challenges that push it above its resting workload. Stairs are simply one of the most accessible ways to do that. If you have a pacemaker or an implantable defibrillator, stair climbing is generally safe, but your device may have a maximum heart rate setting. If you feel your heart rate hitting that ceiling during stair climbing, slow down and consult your cardiologist about adjusting your activity targets. If you take beta blockers, which lower your heart rate, you may not see the same heart rate increase during stair climbing as someone who does not take these medications. This is normal. Do not use heart rate alone to judge your effort. Instead, use the talk test. If you can speak in short sentences while climbing but cannot sing, you are likely in a good moderate intensity zone. Now, let us summarize everything in a simple way. If you want to strengthen your heart muscle, stair climbing challenges the left ventricle and may improve its pumping efficiency over time. If you want to lower your blood pressure, regular stair climbing may help relax your blood vessels and reduce resting pressure. If you want to improve your cholesterol, stair climbing may raise protective HDL and lower harmful triglycerides. If you want to manage your blood sugar, a few flights after meals may help your muscles absorb excess glucose. If you want to reduce inflammation, the muscle contractions during stair climbing may release anti-inflammatory signals that protect your arteries. If you want to lose weight and reduce heart strain, stair climbing burns more calories per minute than flat walking. If you have high blood pressure, start slow, breathe steadily, and monitor your numbers. If you have high cholesterol, aim for consistency and combine stairs with a heart-healthy diet. If you have diabetes, try post-meal stairs but watch for low blood sugar. If you are recovering from a heart attack or have heart failure, get medical clearance first and follow your rehabilitation plan. If you have atrial fibrillation, pay attention to your heart rhythm during the climb. If you are overweight, start with just a few steps and build gradually. If you are sedentary, 2 flights a day can begin reversing the damage of inactivity. And if you are simply aging and want to keep your heart strong, stair climbing is one of the most effective, most accessible, and most underrated tools available to you. But remember, the best exercise is the one you will actually do consistently. If stairs cause you pain or fear, find another way to challenge your heart. The staircase is a tool, not a test. Your heart has been beating for you every second of every day for your entire life. It has never taken a break. It has never asked for a vacation. And right now, it is adapting to whatever demands you place on it. If those demands are low, it weakens quietly. If those demands are steady and progressive, it strengthens quietly. Stair climbing is not about punishment. It is not about forcing yourself to suffer through breathlessness and pain. It is about giving your heart a daily signal that says, I still need you to be strong. And your heart will respond. Not overnight, not dramatically, but steadily, reliably, and measurably. So tonight or tomorrow morning, do not overhaul your entire routine. Do not commit to climbing 20 flights a day. Start with 1 flight. Walk up slowly. Breathe. Notice how your heart feels at the top. Notice how it settles as you continue your day. Then do it again tomorrow, and the day after. Small efforts, repeated daily, are what transform a tired heart into a resilient one. Your heart does not need perfection. It needs consistency, and the staircase is waiting for you, right where it has always been. Before you go, I want to hear from you. Do you take the stairs or the elevator in your daily life? And have you noticed any changes in your breathing, energy, or heart health since you started or stopped climbing stairs? Share your experience in the comments below. Your story may encourage someone else watching this video to take that first flight tomorrow. If this video helped you, please like, subscribe to Nutri Cure, and turn on notifications so you do not miss more simple, science-based health tips for adults over 50. And next, watch our video on the foods that may quietly raise your blood pressure without you knowing. Because what you eat and how you move both shape the health of your heart every single day. Take care of your heart one step at a time, and we will see you in the next video.